Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nursing activities begin in Lagos hospitals after the state chapter of the National Association of Nigerian Nurses and Midwives suspend a 3-day warning strike. And low level of compliance in Taraba schools as students resume academic activities after the Yuletide. And the World Health Organization says more than half of the European population are expected to be infected with the Omicron variant within the next 2 months if infections continue at the current rates. Welcome to the program. School administrators should ensure the daily temperature checks at point of entry and other safety measures are adhered to. According to the Nigeria Center for Disease Control, COVID-19 and its variants spread easily when people come in close contact with one another. Schools are advised to take adequate precautions. Meanwhile, 420 cases were recorded last night in 12 states and the Federal Capital Territory. Here's more on the pandemic update.
420 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 12 states and the FCT, indicating a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 103 infections. Kwara had 90, Akwa Ibom 49, FCT 39, Kano 33, while Rivers registered 31 cases. Cross River and Ogun registered 17 cases each. Kaduna had 15, Edo 11, while Niger, Oyo and Abia logged a single-digit infection. The total confirmed cases in Nigeria now stands at 248,732. The report also includes 0 cases from Delta, Ekiti, Ogun, Ondo, Osun, Plateau and Sokoto states. 482 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 219,479. There were 8 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,085. Currently, there are over 26,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. With over 16,000 positive samples, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. Almost 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.3% of the population have been fully vaccinated. The total global confirmed cases have surpassed 310 million, while deaths are beyond 5.4 million.
Nursing activities have resumed in Lagos state hospitals after the state chapter of the National Association of Nigerian Nurses and Midwives suspended a 3-day warning strike when it had barely taken off. The strike was suspended after a meeting between the nurses and the governor of the state, Babajide Sanwo-Olu. Our correspondent Mary Alele Yusuf visited some hospitals in Lagos and reports.
Work is in full swing at the Gbagada General Hospital in Lagos. At the outpatient section, a canopy outside is packed with patients, and there are more in the hospital corridors. Yet, nurses say it's a light load today, probably because people are not sure they are back in the saddle. Nurses had begun a 3-day warning strike, but cut it short after a meeting with the governor.
Thankfully, the government was able to engage us, and it was a profitable, dialogue. Some nurses have been stagnated on a certain level for some time, so it has been promised that that also will be taken into consideration and they will be regularized. As well, we demanded for, retention allowance as it was done for the doctors, and government have promised us that that also will be implemented. Because there has been, brain drain, we are overworked, a lot of us are having one medical issue or the other. You can imagine just one nurse attending to 20, 30 patients.
At the Lagos State University Teaching Hospital, Ikeja, Nurses are hard at work in medical and surgical emergency ward. There have been engagements between Lagos State nurses and the government before, so one might wonder why the warning strike was suspended in such short order.
What was different was initially we wanted to meet with the governor. It took us over 14 months. He was sending representatives and our agitations were not getting to him. But luckily, when he came on board, I think he was able to look into our agitations.
Now that the nurses have been heard by the highest authority in the state, they believe it would be fair to give him a chance to respond to their agitations. And they say they've been promised that changes will start to take effect immediately. Mary Alale Yusuf, Channels Television News.
And schools in Taraba State have resumed with almost zero compliance to the COVID-19 safety measures following the Yuletide break. While some schools visited within Jalingo, the state capital, shows that some of the guards have been totally lowered with no hand-washing basins, face masks or hand sanitizers or even thermometer checks for resuming students, among others. Though it's the first day of resumption, some principals who would not want their face captured promised to improve.
Schools in Jalingo, the Taraba state capital, resume academic activities for the second term after the Yuletide. However, this is characterized by a low level of compliance to COVID-19 safety protocols. A visit to some of the schools show that students neither wear face masks nor do the schools have temperature checks and have little to no social distancing. Although the state government had provided PPEs earlier, a school principal believes that parents have the responsibility to continuously provide their wards with protective gears to schools.
It is not for the government, it's for the safety of our children, ourselves, the community, and the country at large. So it must start with somebody. So the parents should not relent in providing the face mask if the children have thrown away the one we gave them. The parents should do that one. We shouldn't rely on the government on daily basis that the government should provide hand sanitizer, face masks, and other things. Government have done its part.
The State Primary Health Care Development Agency says it is strengthening its response activities and capacity to deal with challenges posed by COVID-19, including its mass vaccination exercise.
We have aligned our teams that have gone around to do what we call high-level advocacy to political leaders, opinion leaders across board. And that has helped us to reduce the hesitancy and allow uptake of the vaccines across the state. Though still there are pockets of people that have still hesitance in taking the vaccines, but we are doing all we could to ensure that we convince them to understand the fact that we are all in this together. It is not until 50% or 70% of the populace are fully vaccinated, we are not yet safe.
While the pandemic is not over yet, additional measures to be put in place to ensure that students and staff alike are safe.
Well, the head of risk communication with the Nigeria Center for Disease Control, Dr. Yaya Disu, joins us now virtually. Thank you for joining us on the program. Schools have resumed, under another year of the pandemic and a fourth wave in Nigeria. And I also know the NCDC keeps sending out advisories, especially for schools. But are they listening? What have you gathered so far as to adherence to some of these safety protocols?
Thank you very much, Millicent, and good evening, viewers. I think before now, we've already developed guidelines that we have reviewed several times with each wave. For this one too, there are other new measures that were not there before, like vaccination, and then now we're including them, especially for staff and visitors who are coming to the school premises. We have vendors and other people who have business to do. The guidelines are actually informed by science, and it's basically about hand hygiene and physical distancing, wearing of face masks, things that we know that can prevent transmission of this virus from person to person. The additional thing about this is about detection of cases in school. Over time, this is where we have gotten challenges. And most schools may not be reporting these cases, And then I know that Lagos State government, each of the waves in the past, they've reported cases from schools. And then we still need to do more in terms of sensitizing parents, staff, as well as students, for them to be able to report these symptoms. And there must be designated officials in each school, and probably a team that will be able to link up with the local government disease surveillance officers or the state disease surveillance and notification officer who could then follow up with these cases. I think we need all stakeholders to work together, the Ministry of Education, UBEC, and then other relevant stakeholders, Ministry of Health, as well as the community, Parent-Teacher Association, as well as even old boys association in schools where they have old boys such associations. We need to all work together, especially when we are having the fourth wave. We've just finished the Yuletide season. People are just returning back to resume activities, businesses, schools, and it may be too early to be able to say this is the trend, but over time, it will surely show. But if we put all these measures in place, then we are very sure that we'll be able to control it. But another thing that is driven by data is testing. And then now that we have a rapid diagnosis test kits available, and then it's just to empower the schools or link them to health facilities, the State Ministry of Health, that can facilitate this.
Now that you mentioned testing, Dr. Disu, I was just going to know if you could answer that also with, the latest epidemiological situation report from your agency and what it's telling us if we've actually reached the peak of the fourth wave with the declining cases.
Well, sorry, I didn't hear that.
Talking about the epidemiological report from the NCDC, what is it telling us now? Have we peaked with the fourth wave? We're seeing a number of cases that are coming down.
Actually, at the peak of the Yuletide season, generally services and at various states may not be at peak. So people may not be reporting, especially people who travel away from the city centers. It is now that they are returning in the next 2 weeks. And then when activities fully resume, when most businesses start requesting their staff to go and do tests, especially those of them who are symptomatic. And then that way we'll be able to know the real trend. Now, it's too early. People might be having symptoms, may not be reporting. Some might be in villages, rural areas where they may not have access to prompt testing. And then but in the next 2 weeks, I'll be able to know where we really are with this pandemic. But the NCDC is working with the states, Ministry of Health across the country in order to ramp up testing. And then we have reviewed our national testing strategy and then to ensure that people can easily access this testing with RDT, build capacity of various organizations, and for them to be able to use this and link them to the national database so that whatever case that is reported and confirmed and can also be captured in the national database. And then we'll be able to understand the burden of the disease and we can inform further actions.
Dr. Ayadisu had communication with the Nigeria Center for Disease Control. Many thanks for joining us on the program.
Thank you very much.
We have more on the pandemic updates when we return. Please stay with us. Welcome back. India recorded over 168,000 new coronavirus infections. This has taken the total tally of COVID-19 cases to almost 36 million, which includes 4,461 cases of the Omicron variant, according to the Johns Hopkins Coronavirus Resource Center. The active cases rose to the highest in 208 days. The number of deaths also climbed. Meanwhile, Delhi today reported 21,259 new virus cases and 23 related deaths in the last 24 hours. Of the total, the cases of Omicron variant in the country, 1,711 people have recovered or migrated so far. Well, joining us to talk some more about the situation in India is Vishal Rao, who's a member of the COVID-19 task force there. Thank you for joining us on the program.
Namaste.
Namaste. We're seeing cases jumping in different states. Also, we know that India has begun administering the COVID-19 boosters for frontline workers and I believe the elderly as well. And then it will soon begin vaccination for teenagers. What other push is government trying or is government doing? And this is to stem the spread of the virus.
Thank you for inviting me for the program. I think we are at a very interesting juncture where we are seeing that in the race between the vaccine and the virus, the vaccination program seems to be winning. And that's a very significant step that we have been able to do to control the pandemic. So while we see that the numbers are rising today across the states, what has been reassuring is that the need for oxygenated beds and ICUs have been drastically low. Now, this seems to be a direct reflection in states that have had very good vaccination rates. The utilization of the oxygenated beds of the ICU has been very, very minimal, reiterating the fact that the current vaccines are working very well even against the new strains and reduce admissions for hospitalizations for oxygenation or ICUs. So at this juncture, the Indian Medical Council, ICMR, has come out with some very interesting latest guidelines, not encouraging asymptomatic people not to get tested. Now, I think this is a very important and a significant step that the government has taken to ensure that we reduce panic and avoid unnecessary blockage of beds. So coming days we will be watching this closely, and what we've learned from the data from South Africa has been that the Omicron rises very quickly and descends very quickly. So within the next 1 month, we are hoping that we'll be able to bring down these cases effectively, and at the same time, we are continuing to re-emphasize to the general masses that vaccination seems to be the best weapon for controlling this pandemic.
So if someone were to ask with regards to the waves that we've seen so far, and, with Omicron as well, and we, of course, do not hope for another variant, but in terms of hospitalizations, in terms of, do you think that India is perhaps prepared for another strain of COVID-19?
Yeah, I think, like I reiterated earlier, what we know from the data from South Africa and from the Gauteng province has been that if you had 20% requirement of oxygenation or ICU related admissions in Delta wave, Omicron is only asking for 4%. Now, what the WHO Director General Dr. Tedros has reiterated has been that despite having such lower rate of oxygen requirement, Omicron still has the potential to overwhelm the healthcare system because of the rapidity with which it multiplies, which is about 1.5 days. So while we need not panic, and especially those who vaccinated have to be reassured to say that this is not going to get you to the hospitals. So we are slowly moving towards an endemic phase in this particular pandemic. But at the same time, considering the data that we've had in compared to what South Africa is, we know that the oxygen requirement is going to be less because of two primary reasons: very high vaccination rates in several states of the country, and second, there's a lot of compelling data coming out from the UK, from the US, from Hong Kong, and others, talking about how the Omicron strain does not damage the lung. Now, this is a very important thing for the viewers to understand, that the Omicron virus has a multiplication rates of about 70 times in the air pipe and in the bronchus, but not in the lung. In the lung, it's only about 10 times. So it drastically reduces its multiplication in the lungs. And if you are vaccinated, this gives you additional protection. So these are two key reasons why we believe that we need to work towards strengthening the immune system by amplifying the vaccination to the third dose. Israel today has moved to the fourth dose. So what I would urge through this, through your channel to the people of this country and to the other people across the world in Nigeria, across the world in Africa is we need to get vaccinated. Today, Africa, many parts are still at below 5% vaccination. It's a very big concern. We have to make our best efforts to reduce the vaccine inequality. We have to increase the vaccination rate from 5 to at least 60%. And this has to be a combined strategic approach where the media channels help the government to improve and overcome the vaccine hesitancy. And I think that's the best weapon we have against the virus right now. And Africa should take this up seriously and also look at 29 of the vaccine companies that are today ready and have emergency use authorization to open them and bring them to the country to increase the vaccination programs.
And talking about vaccines, is India mixing vaccines? For example, in Nigeria, you're asked to take a certain different type of vaccine as a booster. What's the situation in India?
So the current guidelines do not allow for mixing and matching of vaccines. It's called heterologous vaccination. That means you use the first one of a particular type and the second or the third one of another type. As of now, the government of India's guidelines, the ICMR guidelines, do not allow for mixing and matching. However, what data has come out from the USA's CDC, from the UK NHS, and many other global consortiums, including the EU, has been on two parameters. Number one, reactogenicity, and number two, immunogenicity. Now, both these parameters, it has been shown that when you mix and match and use a heterologous vaccination combination, it seems to be faring slightly better, which means there is one thing for sure that at the end of 6 months, your immune system requires a reminder through a booster dose of the third vaccine to build its antibodies against the virus if it has another attack. So at this juncture, global guidelines say post 6 months, mix and match allowed, and that seems to have good amount of immunogenicity for the immune system and less reactogenicity. So with this data, I think eventually many countries will move towards a mix and match regime, and it's important that we all take cognizance of it.
We appreciate your time. Thank you so much, Vaishal Rao, member of the COVID-19 task force in India. Thank you for joining us today.
Thank you.
And there is a warning from the World Health Organization for Europe that half of the continent will have been infected with the Omicron variant of COVID-19 within 6 to 8 weeks. The Global Health Body's regional director for Europe says the tidal wave of Omicron is sweeping across the region. Here's more on the global update.
Europe saw more than 7 million newly reported COVID-19 cases in the first week of 2022, more than doubling over a 2-week period. The World Health Organization warns that more than half of the region's population are expected to be infected with the Omicron variant within the next 6 to 8 weeks.
Omicron variant represents a new west to east tidal wave, sweeping across the region on top of the Delta surge that all countries were managing until late 2021. How each country now responds must be informed by its epidemiological situation, available resources, vaccination uptake status, and socio-economic context. The region saw over 7 million newly reported cases of COVID-19 in the first week of 2022, more than doubling over a 2-week period.
France's health ministry has reported a record of more than 350,000 new COVID infections over a 24-hour period. The previous record of 332,252 daily new cases was set on January the 5th, and since then, France has seen 2 more days of more than 300,000 new cases over 24 hours, as the highly contagious Omicron has become the dominant variant. Hong Kong has announced plans to shut kindergartens and primary schools and start offering COVID-19 vaccines from children from the age of 5 as the financial hub grapples with an increase in coronavirus infections. China's Tianjin and Zhengzhou have implemented tough new restrictions as they battle the highly contagious Omicron variant. Tianjin has imposed travel restrictions and has launched a mass testing program to help prevent the variant from spreading. Zhengzhou, the provincial capital of Henan province, has also shut non-essential public facilities. Pakistan's largest city, Karachi, has launched a door-to-door campaign to vaccinate women who are lagging behind men in rates of coronavirus inoculation as the country enters a fifth wave of the COVID-19 pandemic. The country reported 1,467 cases over the past 24 hours. On Friday, it reported nearly 1,300 cases in a single day, its highest tally in 2 months, with a positivity rate of 2.5%. The government has not yet announced new restrictions, but has urged people to follow precautionary measures. And finally, thousands of people were seen shopping in crowded markets across India this week as the country battles a sharp rise in COVID-19 cases. The fast-spreading Omicron variant has fueled an almost 8-fold rise in daily infections in the country since the start of the year.
Our website, channelstv.com, has more updates and a better understanding of the pandemic, plus breaking stories at your fingertips. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.